Hello and welcome to Body Acceptance, your podcast for trauma-informed yoga, intuitive eating and self-love. I'm Doris and this is normally a German podcast. However, my guest today speaks English, so this podcast episode will be in English. However, there will be a summary in German very soon. Today's topic is all about eating disorders or disordered eating. I'm joined by my guest, Kate Sweeney, a registered dietitian and fellow intuitive eating counselor. And we are going to talk about the struggles with disordered eating and what can lead to it, what can prevent disordered eating. So if this topic is a tricky one for you, if it's a sensitive topic, then maybe you want to have someone that you can listen to or perhaps decide not to tune in. So just listen to what feels right. I know this can be a really sensitive topic, but I hope that it can enlighten you and bring some more information into this topic and shed some light to it. And happy listening. So, Kate, I'm so happy that you're here. And today will be about eating disorders and intuitive eating. So just tell the listeners about yourself, introduce yourself.
Yeah, sure. It's wonderful to be here. I'm excited for the discussion. My name is Kate Sweeney. I'm a dietitian trained in the U.S. I've been a dietitian now for 11 years. I live in Southwest Germany with my family, which is my husband and my almost 4-year-old daughter. And since becoming a dietitian, I started working right away with clients with eating disorders at Brigham and Women's Hospital. It's also where I did my internship. I'm from outside of Boston, so stayed close to home for my schooling. And yeah, I have a strong clinical background, but also really enjoy the work with clients with eating disorders because there's a lot of psychology involved, as well as just like taking into account the complex nature of food and the way that we eat. So that's a little bit about me and what I'm doing now.
Great. And you said you're a dietitian and you've done a training in intuitive eating.
Yes.
What led you to intuitive eting?
Yeah, so I am a certified intuitive eating counselor. I became one in 2017. I think what led me to intuitive eating was that I had done a lot of clinical, nutrition work, as I mentioned, through my internship and my master's degree. And then after that, working at Brigham and Women's, I was getting exposed to a lot of clients, patients with significant, lung transplant, heart transplant, cancer, digestive issues, lots of different wide range of concerns, which was excellent. But I realized that, we don't do me telling people what to eat or what to do is not effective. So I got some training in motivational interviewing, which you may have heard of. And that was really helpful. But I think overall, I was looking for alternative approaches to helping people with food, because I was kind of feeling like I was banging my head against the wall when it came to, clients looking for having a healthier relationship with food, managing their weight, kind of having better cholesterol levels, things like that. I felt like, giving them a prescription, so to speak, on food was ineffective and does not take into account all the factors that influence our food, our history of food, our complexity of our, how we eat food, our culture. And I wanted a different approach to helping people, especially those with disordered eating or eating disorders, that wasn't so restrictive or so prescriptive in terms of food, and also brought in an ethical practice that provided empathy and compassion for people, because changing behavior is really difficult, and we don't just do that because we're told, most clients, right, they quote unquote know what to do with food or with their sleep or whatever. But there's so much complexity that goes into changing behaviors, and our behavior is so automatic, over time. So I wanted to do intuitive eating to have that as part of my toolbox and help clients better. And it proved to help. I will say it's helped I also use cognitive behavioral therapy and have had training in that, and exposure response prevention therapy and other therapies to help clients. So I see intuitive eating as part of like this larger toolbox that I use with clients at this point in my career.
That sounds great. I think, yeah, when we talk about food, the psychology is such a big part of it as well, because the two are just, I mean, starting from our infancy, kind of connected, right? So it's just so important when you work in nutrition to also have an understanding for at least a small part of sort of human psychology, right?
Yeah, absolutely.
And you mentioned disordered eating and eating disorders. Maybe you can just sort of tell a little bit what is the difference between the two, or how would you maybe use them in your kind of work to differentiate between?
Yeah, it's a great question. I feel like I could spend a long time answering that question, but I'll try to be short. The way I look at disordered eating and eating disorders, I actually don't really differentiate between them. For me, so eating disorders technically are defined by the DSM-5, which is the Diagnostic and Statistical Manual. And so, for example, someone with binge eating disorder needs to be binging a certain amount of times per week. They have to have all these characteristics or particular boxes checked to meet the diagnosis. And for example, with binge eating disorder, one of the characteristics is that they're not compensating with food, like not restricting or compensating for the binge. But as I'm sure a lot of clinicians out there know, like a lot of clients with binge eating disorder do restrict their food at other times of the week or the day. And so I don't find that people fit neatly into these boxes that the DSM-5 has set up. And a lot of our clients also are going to fluctuate between different diagnoses and have different symptoms or severity levels in their eating disorder journey. Disordered eating, I think could be defined as like not having high levels of severity in terms of frequency of binging, for example, or amount of restrictive eating that someone's doing. But to me, if it's affecting their quality of life and their, mental health, like it's just as problematic. So I look at more of a spectrum that people may fall in different places within it, but I don't make diagnoses for clients. As a dietitian, I'm actually not allowed to do that. So that would be the therapist's role. But I also don't approach a client, okay, you had this diagnosis, so this is the treatment, because it's not that clear cut.
Yeah, thanks. I'm sure that cleared some things up for a lot of people, because the DSM is being criticized a lot, right? Because what if you don't meet the criteria, or who decides the criteria? In one episode on this podcast, I spoke about food addiction, and then that was the Yale food addiction scale, right? So who decides what goes into a certain criteria? And then if you just meet 2 out of 3, and then that means you're not being diagnosed, but that doesn't mean you're healthy either, right? So I think using this kind of spectrum approach is much more helpful, and especially when we talk about mental health, right? Because you might not meet all criteria for depression, but that doesn't mean that you're not feeling depressed.
Right. Yeah. It doesn't mean also that you're not, quote unquote, sick enough or worthy or deserving of care. And I think that's what happens sometimes, is when people don't fit in the boxes, then maybe a provider might say, well, it's not that bad, and then minimize it. But it may be very bad for that person, very disruptive and dysregulating. So it's really important that people find someone they can talk to who may be more understanding that these behaviors, don't have to fit a certain criteria for them to be legitimate subjects of, deserving treatment.
Yeah, exactly.
Yeah.
What do you think is a big challenge when working with patients with an eating disorder or disordered eating? Let's just use the term as kind of a synonym, either disordered eating disorders.
Sure. Yeah. So I want to first say, I think I want to be clear, the clients that I have seen in my career so far are probably some of the most resilient people I've ever met in my life. Eating disorders are a way of survival, and they're a way of staying safe, no matter what the symptoms and severity level are. I think what's most challenging, as you and I have talked about in the past, is finding good care for clients. whether that's medical care, psychological care, or nutrition care, finding providers who are knowledgeable about these issues and are not going to do harm, finding providers who understand trauma, who are trauma informed. I think that's been, kind of one of the most challenging things I've seen in my career, both in the US and in Germany. And this is particularly true too with clients who we've been seeing, my colleagues and I have been kind of talking and seeing more of, who have complex presentations, like have maybe chronic fatigue syndrome or long COVID and an eating disorder, or have digestive issues, with an eating disorder. They require, sometimes more medical care, and finding that good care is hard. I think the other challenge that comes up for me when you ask this question is just this, eating disorders are a way of relating to ourselves and to other people. And as I mentioned, a way to stay alive, to survive, to be a legitimate subject within the world, perhaps. And so I find that recovery generally includes a reorientation of the self, and requires sitting with discomfort and distress. So as an example, eating food that may feel really scary because, quote unquote, the eating disorder part feels it's too much, or they're afraid of weight gain. And, that requires a level of exposure to do it, and to sit with discomfort and uncertainty of not knowing what will happen. And I think that that's one of the main things I find with clients in recovery, is that while sitting with the uncertainty is hard and sitting with the discomfort is difficult, when they're able to do it, they're able to relate to themselves differently. They can see things differently. And it's just generally like finding a life worth living for them that doesn't involve these behaviors or thoughts as frequently or at all, So that's like a whole topic that I could talk a lot about, but I think that relationship to self and shifting that and doing the things behaviorally, such as eating or, working on reducing binging, that require that discomfort and that distress to do in the beginning. And then the last thing I think is just like individualizing care for each client that comes through is certainly a challenge, but also, I think really important, because what works for one client is not going to work for another. And as dietitians, we need to be nimble and flexible in the way we treat clients and what recommendations we give, like just to talk a little bit about intuitive eating, I suppose. So for example, all foods fit. Yeah, this may be true for some clients, but there are clients who, if they have mast cell activation syndrome and they have a reaction after having citrus because it's higher in histamine, then this is not going to be potentially for them an option. It may or may not. It's a trade-off for them. They decide, of course. But so it's just that nuance in nutrition, and providing that nuance with clients with eating disorders, I think, is really important.
Yeah, and I think this goes to almost like for eating disorders in particular, but really for any, like food is so individual, and mental health as well, right? Everything is so different from person to person, and we can't just use this kind of formula for every person, because, when you look at the different principles of intuitive eating, you might start with different ones because, maybe hunger and satiety is an issue. And I know when you work with people that have, for example, anorexia, you can't really work with hunger and satiety with them, because they don't really know how to experience that. So maybe you can go a little bit into detail in how intuitive eating can be a tool that's used for eating disorders.
Sure. Yeah. So I think as you're like alluding to, there are themes with intuitive eating that can be helpful when treating clients with eating disorders. So those themes are things like, from my opinion, things like permission giving permission to eat food, adequate food, variety of food, can be extremely helpful and freeing for clients who have had history of restriction or dieting, or, mindset around, not shouldn't be eating X, Y, and Z. It can be quite liberating and also quite scary, but I think that permission giving is a theme that can be utilized with many people struggling with eating disorders. And another theme would be, rejecting the diet mentality and kind of like reducing actually some of the internal stigma stigma we have around our own weight, and body, and that work can also be transformational in helping people push back against, weight stigma, push back against some of the things they may have learned around bodies and what bodies are more, worthy in society and our culture and stuff like that. So I think rejecting the diet mentality is also a good, is a theme that can be used. Satisfaction is another one that I think is, obviously with intuitive eating, they talk about satisfaction in regards to food, but I tend to really think about satisfaction from a broader lens than that, with also a satisfaction with our lives, with what we're doing, with our work, with our families, with where we live, how are we getting pleasure in our life, stuff like this. I think those themes can be helpful because a lot of people who struggle with eating disorders, whether it's restrictive or not, either say yes to everything and don't feel like they're getting what they need, their own level of satisfaction and pleasure, or they really say no to a lot of things and even no to themselves and are trying to control and restrict certain things. So by providing work or helping clients work on the satisfaction, not just with food, but with other areas of their life and finding pleasure, I think this can be really helpful. And we're just stepping back, like just one thing I want to add there too is just that, in the US, I think pleasure is often seen as like something to avoid, in our puritanical kind of society. But also like that this day and age, there's lots going on. There's lots of stimulation. There's lots of like optimization, trying to make people like the best they can be, which is just overwhelming, I think. And I think that drive for like optimization gets in the way of satisfaction and pleasure and just kind of being in the world. So that's a theme that's helpful. And then mindfulness, I think, is another theme that they integrate with intuitive eating, or is integrated intuitive eating, that can also be helpful. So connecting with different parts of our body, connecting with nature, connecting just with our breath, that can be really helpful. So I think intuitive eating overall can provide like a mindset shift and a letting go for people who struggle with disordered eating that can be helpful, but also it does fall short. And like you alluded to that a little bit, so I find that, like any framework, like any manualized thing, it just doesn't work for everyone. And there's issues with it. And so one of the things you mentioned, like the hunger piece, it's really hard. Like I always say to my clients who have struggled with restrictive eating, like, you can eat when you're hungry for sure, but you also need to eat when you're not hungry. Right. And there's going to be times in our life where we eat when we're not hungry. And this is normal. Like, it's totally normal. Like, if I have a meeting today at noon and I know I'm not going to be able to eat till 3, I'm going to have lunch before, even if I'm not hungry. Or if I'm really sick with a cold and I know that drinking fluids and eating some saltines is going to be best for me, but I'm feeling like not interested in that, I'm still going to do it. There's so many other reasons to eat besides hunger that I think that's where I find a lot of clients come in and say, I just want to do intuitive eating and just eat when I'm hungry. And that's the healthy way to eat. And it's like, there's so many other reasons to eat besides hunger. And then to be able to even check in with our hunger, some people can't. Like if you're neurodivergent or you're, it's going to be harder to have introspective awareness. And this is fine. This is okay. So I think also I try to normalize that eating for other reasons besides hunger and eating for emotion is totally normal. We do this sometimes. The other, just like, there's a few more examples I could give, but I think another good one is, the exercise stuff. Yeah, I was an athlete. I swam in college. I did triathlons after college. And if I had done the intuitive eating approach to exercise, I would never have done as well, I would have stopped when I felt pain, but instead you keep going. And so I think with athletes, that part can kind of fall flat a little bit, Yeah. So I think there's themes from intuitive eating that I use a lot in my work. And then there's challenges with it too. And I think the last thing I want to mention, just from a food perspective, is like for some people, intuitive eating, I feel like it does lack structure with eating. And that can sometimes that's very difficult for someone who's been so structured, counting calories, counting macros, etc. I feel like there tends to be a need for a better balance with that, so that they don't feel like they're just without any tether whatsoever to food and eating.
Yeah,
does that make sense? I mean,
yeah, absolutely. I think it just shows that, these with, let's say, an approach, or let's call it a program, just for sort of argument's sake.
Yeah.
I think there can be great programs, and then you just kind of let's look at a self-help book, let's say, or like a certain sort of approach,
Right.
and then you can just read it and you can implement it and you find it easy to do. But then for other people, because of their history, their past, whatever their condition, they are going to need someone to guide them through, maybe with the help of this toolbox, but also maybe other toolbox, right?
Yeah.
And so I think when we talk about disordered eating, or just, people in general that maybe struggle with the things you just mentioned, doing this just with the help of maybe just the book or the workbook or whatever, this is going to be really challenging. So they're going to need almost like a person that works as almost like a translator, or just an individual that helps guide them through, because they realize, okay, I see kind of your bigger, let's say, issues, and then we can use this approach, but we're also going to add, like you said, you can eat when you're hungry, but we're also going to maybe work on almost like a schedule, which might sound counterintuitive when you look at intuitive eating, but for this person, because of their history, this is what's going to work for them.
Yeah, and there's so much in our environment, our food environment, if we want to be really specific, that also make it hard to be intuitive. If we go to a grocery store in the US, it's like there's so much food available. It can be overwhelming. It's hard to be intuitive. And I think that there's so much nuance, as we've been talking about. And I always think, like, my goal for someone is not that they're an intuitive eater. Like, that's not my goal. My goal for them is whatever their goal is for themselves. And if they want to be an intuitive eater, whatever that means to them, I want to define it with them. We also have to understand, is that realistic for that person? Again, some people think, well, it's just eating when I'm hungry, stopping when I'm full, things will be better. I'll actually maybe even lose weight from this, and it will just be kind of perfect, and I'll get to eat whatever I want, but I'll never have an issue with food again. And, sometimes there's some magical thinking in that. I take that broader view of intuitive eating, where it's more informed by other factors as well. And it's not necessarily a place that you arrive at and you kind of like, this magical thing happens. It's a process, and there are pieces of the process that may work for you and pieces that may not. And having someone, like you said, to guide you through that, I think can be extremely helpful. And as clinicians, I think it's important that we don't wed ourselves to one particular way of doing it, or say that the goal should be intuitive eating for the person. Well, who are we to say, and again, what does that mean for them?
Exactly. It's not like a mold that you're supposed to fit. I think it's a spectrum itself.
Yeah.
And I remember in my training, it was mentioned that one of the kind of, let's say, like, founders of intuitive eating, I think they have breakfast and read the newspaper, which, if you look at like kind of mindful eating, that's not really mindful eating, but they're kind of, they've been doing this for a long time, and they know for them it's mindful, and then, that's perfect for them. And that's kind of, I feel like, a rule you can apply to all the other principles as well. That it's like, the individual is the only person that can really say, look, this works for me, or this doesn't work for me, or this feels intuitive, because what really is intuition anyway? Like, how can you quantify it,
Yeah, that's a whole podcast we could do.
Exactly.
And I think what's hurts, you wanted to ask me about social media. So I think, like, what hurts and what I think is problematic is that, so I'm not on social media at all. I don't engage with anything except Facebook, for just the sheer purpose of connecting with colleagues. And I also see mostly adults. So I see adults who are on social media, if they're on it. I personally find it way too stimulating. It would take me away from myself. I cannot even think about marketing through Instagram and 5 words to put on a slide. I'm horrible at that. Again, there's too much nuance that I'm just I get too down in the weeds. But one of the things I hear a lot from clients is like, again, I want to do the intuitive eating. I want to do the hunger fullness. And I think there's, from what they tell me, I'm not on it, but they hear a lot, from other people that intuitive eating is this like amazing thing that's going to fix your relationship with food, and that, you're stop when you're full. And the reality is so much different, and I find it hurts people, frankly. I think some of the marketing around it, well-meaning as it probably is, gets people confused about what it actually looks like. Like you said, like sometimes you want to eat with a newspaper and sometimes you don't. And sometimes I eat in front of when I'm doing work and sometimes I don't. There's no, it takes too much willpower and time, and we don't have that much each day. Again, most of our behaviors are automatic, to be like always mindful about food.
Yeah. And I think intuitive is also, it's kind of a little bit like a buzzword these days. People can, I don't know, like, as you said, you're not familiar with social media, like personally. And, I think better for you almost. I feel like if you look at, I'm on social media and I often speak about the downsides. And I think if you compare the pros and cons, to me, the cons just weigh out like at the end of the day. But I think there's a really big trend about this, what is called What I Eat in a Day, where people show what they eat,
Yeah.
And it often says like intuitive, no restrictions and so on. And then you look at it really like from a kind of professional point of view and thinking, okay, I see some red flags here. And I think it's just in general, social media it's very hard for people to just understand what they're seeing. It's very stimulating, as you said. And I think when we talk about disordered eating or eating disorders, your teens are such a crucial time in your life for this, right? And I think there's just, for them, what teenager doesn't have a smartphone, doesn't use TikTok, Instagram whatsoever? Even if the parents forbid it, they're going to find a way around it, likely, right? Yeah. And so do you think that is something that is challenging currently and also in the future?
Oh, definitely. I know a little bit about the research. I believe the research indicates, girls in particular are more bullied on social media than boys. And like we've seen in the US, an increase in self-harm and suicidality for girls in particular. They're being exposed to a lot of ideal bodies, ideal, food, as you just mentioned. And it isn't real. Like social media to me is not real. It's a weird, like, funhouse mirror in some ways. It's an American thing, I feel like. But, just you look and you're like, okay, this doesn't seem right. But it also seems very appealing. And with my clients, what I hear from them is like, for example, with adolescent clients, we may work on, with their therapists, like they may work on, I think you can filter certain hashtags and things out from your TikTok feed or from Instagram, but then the algorithm is such that the things that we're trying to like not have the client be exposed to, like what you eat in a day, great example, they do end up coming back in the feed. So even when you're trying to help the teen, not be looking at this stuff, it's constantly there. And there's just a lot of misinformation as well, like, and this emphasis on health being like this goal, that like you should be healthy. And again, go back to optimization and all of this. And if you just do this, it'll fix your digestive problems. And then that's just mixed with this misinformation. And so things are just flattened in terms of, nutrition advice and exercise. Not to mention all the body image, like body stuff. That stuff is a really bad, not helpful word, but like the idealism of like bodies and weight loss still is so prevalent, And like you said, it's not like all social media is bad. There's definitely positive accounts and things like this. But for me, like you mentioned, it seems like things don't feel real. And there's always another person, typically, from what I understand, they might want to be selling products or something like this. There's always like other things in the mix besides just providing information to people.
It's a fun advertising market kind of thing. like an
Yeah.
entertainment. It's not like a fun channel, you know?
Right. Yeah. And I think too, like it takes time, right? So like if you're a teen, and you're spending an hour or two on it every night, then that's going to affect your sleep and, the times you could be hanging out with people in person and things like that. So I'm not an expert on it, but what I see from my clients is that it confuses things more than it helps. And we end up spending time, talking through that. It provides misinformation and this idea that like you're healthy and you've reached this moral like place if you're like the most healthful person and optimize yourself. And it's just not real. Like life is much more complicated and nuanced than complex. And we're putting ourselves into, eating and nutrition becomes kind of a new religion in a sort.
Yeah, that's such a good phrasing, like eating is the new religion kind of thing. And I definitely think that like social media is something we're gonna, have to, I mean, for anyone that works in food, or nutrition, you always need to be aware of, okay, what's kind of a hype currently, what is sort of popular, and then you have to kind of dismantle all these like false claims and so on. But as we talk a little bit in terms of what affects maybe disordered eating, what are ways that you can think of that maybe prevent eating disorders, disordered eating, maybe, for just parents potentially, but also, I mean, we can all affect other people around us. So what are ways, in your opinion, that can help prevent disordered eating?
Yeah, it's such a great question. It's a huge topic. I presented at a conference last year on this topic because it's so important. We don't talk about prevention so much because we're like in the throes of treatment often, And research wise, there's not a lot of research on what is preventive. Like, I mean, there's research, I want to be clear, but what actually reduces the incidence of eating disorders, what's been shown to do that? The only programs that have been shown to do that are dissonance, peer-led programs that create cognitive dissonance for the people involved in the program. So that means like, if what I'm doing is like weighing myself every single day, but my belief is that I'm worthy and good, like my core belief, then there's a dissonance between what I'm doing, my behavior, and my belief, So these programs like the Body Project is one of them, helps to highlight dissonance and helps participants kind of be aware of that and then create other strategies, do other behaviors that are in line with their values and their beliefs. That's just a very short-term way of explaining it. So we know that may help. That's the only program that's been shown to like actually reduce incidence of eating disorders over years. But what's protective? And I just want to add, sorry, that that eating disorders are so complex in how they develop, right? So there's genetic, there's psychological, there's socioeconomic, there's cultural, there's relational. So there's all these components that are affecting how eating disorders develop. And so in order to prevent something that's so complex, right, it's so hard to know what's protective and where do we start. And the protective factors that we do know about are like someone being able to provide themselves self-compassion, parents and families who don't emphasize body, weight, or shape as something that needs to be changed or that something's wrong, and also like not living in a westernized culture, interestingly. So the one thing I would say to, that can be the most helpful is the parents. They are, in the research, it shows that they're the most important factor in the kids' like for the kids' development of a potential eating disorder. So I think for parents no one's a perfect parent. I'm a parent. I struggle and question myself every day. But with food and exercise and body, if we're struggling as a parent, I always say to people, like, get help so that you can heal a little bit for yourself, right? And then how do you want to approach it with your kid? Do you want to be talking about food? Body, like if I tried on a dress and my daughter was there and I was like, oh, I look so horrible in this. It's so, I'm so fat. I look so fat. And fat's not a bad word. I want to be clear. But in this context, I'm using it as kind of like putting myself down. Then she's going to get that message over time that like, there's something wrong with mommy and she doesn't like her body. So maybe I should be, looking at my own. So certainly, creating a positive attitude around body and food and allowing foods in the house. And like I always say to parents, like putting all foods out when you serve food, not just the vegetables, but also, the brownies or something if you're serving that day. Not having rules around, you must finish this before you eat that. I think Ellen Satter, who's a dietitian from the US, who has a great the Ellen Satter Institute. She's been around for a long time. She has a division of responsibility with parents and food, and I use that a lot. I think it's a really helpful tool. So what are parents responsible for versus kids? Kids determine how much they want to eat and what they want to eat of what's offered. But parents determine what and when and, what they're putting out. So trying to help your kids be autonomous around food, allow them the opportunity to eat the food that you've prepared, getting them in the kitchen with you, having them touch the food, having rituals around food like birthday parties and cultural or religious, events around food. And then not demonizing the food as being good or bad or, getting in the way of your ultimate weight goal, quote unquote, or something like this. So really trying not to tie the food to, your weight. And then I think also, and I'm not the expert to talk about this, but I think that we know that a lot of eating disorders also develop when kids have trauma as a young kid, right? Or they experience the feeling of shame. They may use food as a way to cope with that, with like binge eating, for example. So securely attaching to your child, we know, is really important, and allowing your kid to know that they're okay no matter what, even if they do something wrong. So providing them compassion and really, again, we're not perfect as parents. We're going to raise our voice. We're going to, get upset at our child. But I think as parents, we can help our kids attach by just letting them see that they're okay no matter what happens. And I know that's quite a broad statement without much detail, and there's probably people who can speak to that much better than me.
It just shows that compassion can go such a long way, right?
Yeah.
And we're gonna put, like you mentioned, Ellen Satter, we're gonna put her in the show notes, and also everything about UK, so that people can reach out to you as well. Mm-hmm. And this has been such an important topic to talk about for me, and I'm sure that many listeners can also relate to, whether they've experienced eating disorders, disordered eating, or whether they know people. And as we come to a close, I just want to go a little bit back and make this more personal and ask you sort of what is, at least currently, like your favorite self-care activity, and also how do you practice body respect or body acceptance for yourself?
Mm-hmm. Well, my favorite self-care activity, probably because I spent 4 hours a day in a pool swimming and looking at a black line, is to move. I do enjoy movement. I don't do it nearly as much. I'm now over 40, and I don't train the way I used to train or anything like that. But just a walk or a quick run or some yoga or weightlifting or something. I like moving in my body, and I especially like being in the water and moving my body, even if that's it's not a pool necessarily, just like the ocean. And honestly, I really like resting. I feel like, we talk about self-care, and I don't often hear the answer I just lay down, but that's how, I feel like since having a kid, and not maybe having as much sleep as I would have would like sometimes, I used to think, I need to always be doing something. So moving is helpful, but I also just really enjoy laying down on a Sunday and just taking a nap, or just literally staying immobile for a little bit.
Rest is best, right?
Yeah, rest is best. We often don't give ourselves the opportunity to do that. And I still struggle with it for sure, and finding the time, but just recognizing, okay, I need some rest. Yeah, it feels good. And then how do I respect my body? I think there's this great book from Dr. Hilary McBride. She wrote a book called Mothers, Daughters, and Body Image that I think is pretty good. And I think it was from her book, or maybe I listened to a podcast with her or something. But this idea that, you treat your body, some people, we often treat our body as like a house or a pet, like something that we're trying, like something that's outside of us that we're trying to make better, quote unquote. So I always try to think of that as like, for myself, it's like just reminding myself that my body is me, that there is no other me. Like my body is mine and I don't need to make it better. I'm not a project to be worked on, and just my body will change. I've been pregnant, I've gone through athletics, now I'm not so, in that area. My body changes over time, and just kind of working through both grieving that, because it is hard when your body changes, and accepting it and doing things that model for myself and my daughter that I'm, accepting of it. So even when I don't love it some days, because there are definitely days I don't love it, I still treat it with respect, whether that's resting or moving or whatever. So that's kind of how I would say I provide body respect, is trying to keep that perspective in mind and not let my body become an other, and treat it with respect when I don't necessarily love it for whatever reason. Our bodies don't always cooperate, even just on the basic functions of daily life. Like we have a long work day, but we're feeling exhausted. And yeah, sometimes like, oh, so frustrated with you, but how can I, give it some time or rest that day, even though I'm feeling kind of annoyed.
Amazing. Thank you so much. I'm sure many people can relate to that. And it's quite a common answer that I get to the last questions, is respecting it, even if you maybe don't appreciate it that day. So Thank you so much, Kate, for your time. Again, all the information about you will be in the show notes, and then people can reach out to you.
Great. Thank you, Doris. It was lovely to talk with you.
All right, that was it. I hope you enjoyed it, and I'd really love to hear feedback, and maybe that you have some follow-up questions. I know this was a very broad topic that we only just sort of scratched the surface on, but I personally am very invested in the topic. I find it super important, super interesting, and I hope you did too. I hope that you tune in soon once again, and have a great day.